good? Welcome to MIDE. After 10 years of attending this exhibition as a visitor, I'm very honored today to be addressing all the dive pros, my fellow divers, and also those who are looking to join the dive community in this platform today. So before I start, I would like to introduce... While I wait the mic to work. Okay, my name is Dr. B. Cho Yin. I'm an ear, nose, throat specialist with 14 years of clinical experience. I'm currently practicing in Assunta Hospital, Petaling Jaya, and I'm an active diver for the past 15 years. I'm also a member of the Asian Hyperbaric Medicine and Diving Medical Association, known as ADMA. So you must be wondering why is an ENT doctor talking in MIDE today? I'm here to raise the awareness on the importance of ENT health in diving. We all know we face increased pressure when we are underwater, and according to statistics, about 80% of dive injuries and illnesses are related to ENT. So my role today is to reinforce the importance of ENT health to ensure safety, prevent injuries, and also enhance overall diving performance. So what is in the agenda today? For the next 20 minutes, I will be describing 4 case scenarios in an interactive manner where I will hope to invite all of you to participate and also discuss together. Without further ado, let us start with our first case scenario. A scuba diver presents with right ear bleed and muffled hearing immediately after completion of a dive to a max depth of 18 meters. Can I please have a show of hands who thinks is A, an ear infection? Or B, is it decompression sickness? Okay, C, an ear squeeze? Or D, a marine animal bite? Okay, very well. Most of us got it right. It is an ear squeeze. The diver had nose allergies and he experienced ear pain during descent and wasn't able to equalize, but he continued descending and forcefully equalizing, and eventually he felt pain relief when his eardrum ruptured. He was very lucky he didn't present with giddiness. So if you look into the picture on our right side of the screen, it is the all-new classification of middle ear barrel trauma. On the extreme left, you will see that a normal ear canal is pale pink in color with a translucent eardrum. As the injury worsens, the eardrum will become more and more inflamed, and eventually blood can accumulate behind the eardrum. Worst case scenario, it will rupture like in this diver's condition. So what is an ear squeeze? It is also known as a middle ear barrel trauma, which occurs when there is a pressure difference between the air space between the middle ear and the external environment. The external environment that we're referring to is the outer ear, and the middle ear cavity is the area behind the eardrum. So this middle ear cavity is connected to the external environment only via the eustachian tube, which allows passage of gas across. When this eustachian tube is no longer working well, the middle ear cavity negative pressure will force the eardrum to push inwards, causing inflammation and accumulation of fluid. When the pressure is too much, something's got to give, so the very thin tympanic membrane will get perforated. So how can we do to prevent this from happening? Don't dive with nasal congestion or ear block, and treat the nasal allergies before a dive trip. If there is pain, please don't descend any further. And it is also quite good to master more than one method of equalization. For first aid management of such cases, I would recommend a review of the dive plan. In the case of this diver, his eardrum has ruptured. He definitely cannot continue diving. But if it's a mild case of middle ear barrel trauma and the diver can continue to equalize and there's no further congestion, we may consider allowing the diver to go for the next dive, but we must reinforce equalization techniques. Nasal decongestant sprays, drops or pills, as well as painkillers would be helpful in this patient. When should we seek medical help? This patient who has a ruptured eardrum should get medical evaluation the next day. Do not use any eardrops unless it's prescribed, and he may go and see an ENT later after the dive trip. please look at this picture and tell me what is your spot diagnosis. Is it A, a trauma from pinching the nose too hard? Okay, no takers for that. Could it be B, heatiness? Or could it be C, decompression sickness? Nope. Or is it D, a sinus squeeze? Okay, everyone got it right? It is a sinus squeeze. I'm sure many of us have seen this happening during our training on open water. So this diver had mouth flu in the morning and he experienced cheek pain when he was descending. And it only took a few attempts before he could actually descend. Later on, he also spat out blood from his phlegm and he developed headache and nasal congestion, even worse after the dive. So what is a sinus squeeze? Sinus squeeze is sinus barotrauma. It occurs when there's a pressure imbalance between the sinus cavities and the external environment. Looking at the picture on your left, it is an anatomy where it shows that in our skull, there is 4 pairs of air-filled cavities called sinuses. And these sinuses are connected to the external environment via narrow passages in the nasal cavity. When the passages are blocked and the diver goes underwater, negative pressure within the cavity will cause the mucosa to tear and bleed. When the diver goes back to sea level, the positive pressure will then push the blood out of the nasal passages, hence the nosebleed. If you ask, if it's nosebleed, why is the diver spitting out blood? It's because nosebleed sometimes trickle back to the throat and then it presents as blood in your phlegm. So again, we will ask, how do we prevent this from happening? Don't dive with nasal congestion and ear block. And don't descend any further if there is pain experience. If a diver is unwell, please consider a shallower max depth for that particular dive. The immediate management for this particular diver is to review the dive plan. If the diver has only very minimal bleeding in the mucus and doesn't have headache or worse nasal congestion and still can equalize, you may consider allowing him to dive but at a shallower max depth. However, if it's in this case where there is headache and worsening nasal congestion, I would strongly recommend not further diving. Nasal congestion spray, nose and pills are going to be the most helpful thing for this patient. Some painkillers will help for the pain and antihistamine pills to treat the allergies. I would like to recommend that in divers who present with sinus squeeze, do always check them for ear squeeze as they happen concurrently. In this case, when do we send them for medical evaluation? If the diver has headache and nasal congestion worse than before, they will need medical evaluation the next day. However, if it's only a very mild situation, they can see an ENT later when near completion of the trip. Okay, let's go into our third case. A diver started having right ear itchiness after 6 dives, and it became unbearably painful by the end of his dive trip. He felt that his right ear could not hear very well. Can I have a show of hands? What is everyone's idea of what's happening? Could it be A, decompression sickness? Nope. Could it be an ear canal infection? Not sure. Could it be an ear squeeze? Could still be. And could it be an insect bite after something crawling inside? Okay, actually the answer is an ear canal infection. So this diver has been cleaning his ears every day with cotton bud after diving. And he noticed yellowish stain on the cotton buds and it was very foul smelling. His ear eventually became so painful that he could not even wear his earphones or earbuds. So what is an ear canal infection? It is also known as otitis externa. It's a painful condition where the ear canal becomes inflamed and swollen after infection. As you can see in the picture, the area that becomes infected is the ear canal that becomes narrow from the inflammation, and eventually it starts to discharge pus. So how do we avoid this condition? Don't use cotton bud. This must be the statement that's repeated most often by ENTs all over the world. You may gently dry your ear with a hair dryer or fan after shower. And if there is a diver who is very prone to this particular condition, you may consider using acetic acid ear drops to prevent it. Acetic acid eardrops can be purchased from the pharmacy, or it can be made at home with a half and half solution of white vinegar or apple cider vinegar mixed with 95% alcohol. The 95% alcohol will dry up the ear canal, and the vinegar will create an acidic environment which will prevent bacteria from growing. You may try it out if you often have this condition. Do check the ears for earwax and have it removed before a dive trip. First aid management for this condition would be painkillers, of course, because it's so painful. You may try using acetic acid eardrops in the initial phase when there's itchiness. And if you do have antibiotic eardrops at hand, you may also use that as well. Please do not attempt to clean the ears with cotton bud or stick, as it will worsen the condition. This particular condition is not life-threatening and does not need immediate medical evaluation. You can go home and see a normal GP, or if there's ear cleaning required, you may see an ENT doctor. Alright, is everyone still with me here? Okay, that's great. So my fourth case scenario is a rather unusual one, which is a little complicated and maybe an interesting topic of discussion among the dive pros. A scuba diver suddenly developed spinning sensation underwater after a forceful equalization. He felt nauseated and vomited several times on board after coming up. He also had ear coolness and persistent ringing in his left ear. Do you think it is inner ear barrel trauma? A raise of hands. Okay, very good. Could it be decompression sickness? Possible. Could it be seasickness or motion sickness? Okay. And how about low blood sugar? I think we get that quite often. Not really. The answer is actually inner ear barrel trauma. But don't be discouraged if you think it's decompression sickness, because inner ear decompression sickness presents very similarly. Okay, so this diver, he had trouble equalizing during descent as he felt pressure and pain in his ears. So after a very forceful equalization, the ear block was partially relieved, but suddenly he had severe giddiness underwater. On board, he noticed he lost his left hearing almost completely, and there was abnormal jerky movements of his eyeballs. I'm not too sure you can see on the video. Video not playing? Okay, never mind. You can, this is the abnormal jerky movements of his eyeballs that you can sometimes see in divers who present with severe giddiness on board. So let me tell you a bit about inner ear barrel trauma. It is damage to the inner ear structures due to rapid change in pressure between the inner ear and the external environment. The inner ear is that pink color region in the smaller diagram, which consists of a balancing organ and the hearing nerve. It is located behind the middle ear cavity, so the area. And it is connected to the middle ear cavity by a very thin membrane called the round window. You could also almost think it like a mini eardrum. So when the eustachian tube is not working and the diver attempts to forcefully equalize, the increase in pressure actually causes the liquid in the balancing organ to push forward into the round window, causing rupture. And when that happens, your inner ear structures are damaged, causing severe giddiness and hearing loss. So what do we do to avoid this very uncomfortable complication? Number one, don't dive with nasal congestion and ear block. Equalize early and frequently. Another thing that we don't emphasize enough to our fellow divers is to equalize gently. Master more than one technique of equalization would be very helpful. What is the first aid management of this? We take this very seriously. We must abort the dive immediately, and if you have oxygen, please administer 100% oxygen. You may ask the diver to lie or sit down and close the eyes to help with the giddiness. Avoiding rapid movement will help with the giddiness as well. Try not to equalize the ears, although it's very tempting because the ear block is there. At this moment, decongestant nasal sprays or drops may still have a role to help. This diver needs immediate medical evacuation and evaluation. They need to rule out DCS for this patient. In this situation, the ENT doctor is the best doctor for this. Okay, Now that I've described 4 case scenarios, I hope everyone here has a better idea of the common ENT-related dive conditions that can happen. Now, I would like to share 4 practical advice for safer diving. Number 1, if you are going for a major dive trip, or you're embarking on a new open water license training, or you have developed dive complications before, please go for sinus and ear checkup to ensure that you're in good health, because prevention is better than cure. Number 2, I cannot emphasize enough the importance of good equalization technique. Every diver must master equalization technique and practice it often. Number 3, post-dive care. After every dive, at the end of the day, please dry your ears carefully and gently to avoid infection, and use the acetic acid eardrops when necessary. Number 4, if you have frequent sinus or ear issues, it would be recommended to have a regular follow-up for your ENT specialist to manage these issues. Diving is a wonderful sport, and it requires careful attention towards safety and health. By understanding the risks and taking proactive measures, you can enjoy safer diving experience and also uninterrupted diving journey. Before I end my presentation today, I would like to share some exciting activities happening in the Asuta booth located at A161. We are doing free health tests, free. I will be providing an ear endoscopic examination whereby I will use a camera to show you your ear canal and eardrum. So it's very exciting. If you're interested in this, please scan the QR code on the screen to book your slots. We are also offering cholesterol, glucose and blood pressure monitoring as well. Do drop by. As part of my commitment to advocate for divers' health, we have customized 2 medical checkup packages tailored specifically to divers. It is available now, heavily discounted for a limited time only. Please do drop by our booth to find out more. This is our booth A161. And now that I've finished my presentation, is there any questions that I might help you with? While we are waiting for the questions, may I boldly ask everyone to please follow me on social. Add me or follow me, yeah? Any questions for me from the floor or around the corner? Okay. If there's no questions, I will happily I will exit now. Bye-bye. Please visit my booth.